Apologies for the poor production, but in this presentation I'm going to move on and look at my paediatric bag. If you've already watched the presentation on adult bags, you'll have heard me say that there's no ideal bag available, and that's particularly so for paediatrics. And everybody's different in terms of what equipment they need to carry, or they feel they need to carry, and a lot of that will depend on your own area and your own experience. Personally speaking, I've got another of these old Scottish ambulance service bags that I keep specifically for paediatrics. You probably can't read it, but it says paediatrics on the front. I know it's my peds bag because it's in better nick, because it doesn't get used as often, and it's not quite as tightly packed as my adult bag is because of the equipment I have in it. But it works on largely the same principle, which I like. Again, I have a flap system here at the front, which when I open the flap up, I've got most of the equipment available to me as in my adult bag, but just obviously sized for paediatrics. A variety of paediatric nasal and oral airways, tough cut scissors again, some lubricating jelly, a variety of syringes and needles, some smaller cannulae, some more jelly here, an extension set, and also some adrenaline. Adrenaline's quite useful for paediatrics. It's something that you use fairly often, particularly in critical paediatrics, so I have some adrenaline standing by ready. In the front of the bag, just like my adult bag, plenty of protective gloves, oops, too many, and a sharps bag, some cling film for burns. I've got paediatric bag valve mask set with a variety of bags and connectors for the various ages of children that you may come across, and I've also got a suction device in this part of my bag. I don't have 2 BM glucose monitors, so there's some equipment I would need to share with my adult bag, but that's just purely on practicalities. And again, quite often in paediatrics, apart from oxygen, which I carry separately, I rarely have to open much more than that to manage a situation. Moving on in the bag, as with my adult bag, I carry 2 of the fairly new Stiff Neck Select paediatric collars, which give you 3 sizes, PD, MIDI and Mini. Work on the Stiff Neck Select system, and again give you a good balance between practicality and practicality and carrying ability. And I don't use paediatric collars very often. I've used them twice in the last year, but they are useful to have. In the next section of my bag, I've got some kit really designed for the sort of paediatric things that I deal with commonly. I've got a bag here that's set up really for the administration of buccal midazolam, particularly. You can't see it, but there's a bottle of epistatus midazolam solution in that compartment there, along with syringes. And this compartment here is set up for the administration of intranasal diamorphine, which is my preferred method now of analgesia in children. It works extremely well, and I'll maybe put a separate presentation online to discuss it. But in my experience, both on the ski patrol and in general practice and at road accidents, intranasal diamorphine for children is an absolute godsend. It works so well without hurting a child and without needing intensive practical skills. I've got a variety of bandages, sleek, and so like in this bag here. I've got a neonatal bag here, which is specifically designed for those situations, I suppose, for the home birth or an unexpected delivery, with a variety of suction and other pieces of kit as recommended by the obstetrics unit. And then a couple of bags here with a few more bits and pieces that I've found to be of use over the years: tape and scissors and bandages and hypothermia blankets and that kind of thing. There's also kit in there for dealing with surgical airway, and also for providing a chest trauma, open chest trauma, a modified version of an Asherman's chest seal. I don't carry a specific paediatric chest drain. I feel that's beyond me. I could decompress a pneumothorax, I think, if I had to, but I wouldn't be looking to insert a chest drain in a child. And in my final section here, just as in my adult bag, this is really a mirror image of my adult bag. In here, most of the bag is given over to advanced airway, and I've got a variety of small laryngeal masks and ET tubes here, cut to size. Cutting tubes to size is important. It's not something you really want to be doing at the scene of a critically ill child. More cannulaes, some more specific paediatric cannulaes down here. And then in this bag here I've got, again, normal saline fluid, one 500ml bag. A paediatric bone injection gun for those situations where you need to think about intraosseous access, as well as a standard intraosseous needle. I'm hoping to move over to an EasyIO system fairly soon once the price comes down. And then in this bag here I've got a couple more LMAs and also some PediCaps, which is a carbon dioxide detector specifically for paediatric tubing, for if I do have the unfortunate situation to have to ventilate a child. Paediatric specific laryngoscope I should have mentioned, and also a couple of paediatric specific airway aids such as sized forceps and the like, and also an ET tube connector as well, which is very useful. And that completes my paediatric bag, largely the same as my adult bag, just with smaller pieces of kit for children, and specifically two sections set out for the use of buccal midazolam and intranasal diamorphine for analgesia.